Welcome to this video on mental health parity and maternal mental health equity. We will explore how to bridge the gap between federal mandates and culturally responsive care. The Mental Health Parity and Addiction Equity Act, or MHPAEA, legally requires insurance plans to cover behavioral health comparably to physical health. However, treatment disparities, especially in African American maternal mental health, show that legal parity does not guarantee practical access. The systemic fix requires strengthening enforcement and mandating culturally responsive care networks. Pre-2008 saw disparity with strict limits on therapy, high copays, and restricted access to providers. MHPAEA standardized parity, aiming for equal treatment limitations, comparable deductibles, and equal access to in-network providers, eliminating systemic discrimination against mental health care. The MHPAEA mandate rests on 4 pillars: financial requirements, treatment limits, prior authorization, and network access. These pillars ensure equal financial terms, comparable coverage, similar administrative processes, and equal access to both in-network and out-of-network behavioral health providers. The enforcement pipeline extends from federal oversight, including the U.S. Department of Labor and CMS, to local enforcement by state regulators like the Maryland and D.C. departments. This oversight covers employer-sponsored, Medicaid-managed care, and marketplace plans. Despite parity laws, evidence suggests utilization has not significantly changed. Data shows little to no change in service use or out-of-pocket spending. This is due to lingering structural barriers, like provider shortages and restrictive network designs. Legal compliance can mask practical barriers. The legal standard allows insurers to implement access rules that are not more restrictive than medical services. The loophole is that legally permissible, rigid hurdles, even if applied equally, disproportionately discourage those with acute mental health crises from seeking care. Maternal mental health, defined as a mother's well-being during and after pregnancy, warrants urgent public health focus. Maternal mental health conditions are a leading cause of complications and deaths. Evaluating MHPAEA must measure effectiveness in protecting vulnerable birthing populations. Intersectional factors compound access barriers for African American mothers. Approximately 40% experience maternal mental health conditions, yet they are half as likely to receive treatment compared to Caucasian mothers. Disparities are compounded by race, income, gender, and geographic access. Behavioral health providers face competing systemic pressures. Systemic pressures include increased patient demand and intensive administrative burdens. Systemic benefits include potential for improved reimbursement rates, expanded coverage for underserved populations, and enhanced long-term financial sustainability for clinics. Equitable coverage redefines the client journey to care. Step 1 provides financial relief, reducing out-of-pocket costs. Step 2 involves service expansion, offering access to postpartum mental health services. Step 3 leads to quality of life improvements through consistent therapy. This journey requires culturally competent providers. Culturally responsive care is key to effective parity. It is a patient-centered approach that integrates a patient's cultural background, values, and identity into healthcare. True health equity requires providers to reflect and understand the lived experiences of African American mothers. Targeted policy actions can strengthen local implementation. Step 1 is strengthening state-level enforcement through rigorous audits. Step 2 involves expanding community-based services with direct funding. Step 3 focuses on incentivizing culturally responsive care through mandatory training and network adequacy standards. Overcoming persistent obstacles requires sustained advocacy. Immediate barriers include provider shortages and complex insurance limitations. Future directions include expanding provider pools, continued state-level policy work to close loopholes, and sustained advocacy for marginalized clients to utilize equitable mental health coverage. The equation for health equity is legal parity plus culturally responsive care equals true health equity. Health equity means everyone has a fair and just opportunity to attain their highest level of health, regardless of race or income. Key resources are available for implementation and advocacy.